Hi, it's Daryl Mossberg, and I'm here with Roseanne Catalano, Cyton's Clinical Director.
We're here today to introduce you to Cyton's newest technology, BBL Hero.
I'd now like to walk you through our BBL Hero treatment for the face, which is accessed using our Forever Young BBL Plus soft key. Once you've pressed the soft key, you can then input the proper amount of energy, your pulse width, your rate or speed, and temperature of your chill plate, referencing the safe start parameters, which are located inside of your operator's manual. If we take a look at the safe start protocols, you will note that depending upon the patient's skin type, you can elect to use anywhere from the 560 nanometer for skin types 1 through 4, down to the 640 nanometer for your skin types 5. Again, darker or more melanated skin types would necessitate the use of a deeper penetrating filter. If you're unsure whether someone is a 3 or a 4 or a 5 or a 6, make sure you try to type them into a darker skin type because that's going to be safer for the patient. Once you have set up your safe start parameters and you've placed in the appropriate filter, you're going to make sure that you've also gelled all of your finesse adapters, which we'll use throughout the treatment depending upon the surface area where we are concentrating our treatment. For your treatment, your energy will range from 4 joules for your darker skin types, all the way to 6 or 7 joules for your lighter skin types. Again, if in doubt, always reference the safe start parameters in the operator's manual. For our patient today, we are dealing with a skin type 3. Therefore, I'm going to elect to start with the 560 nanometer filter, which I've already placed inside of my BBL handpiece. I'm also going to apply the smoothie adapter as I'm going to start on the larger area of the face, which is the cheeks. If I check my operator's manual, it gives me the range of 6 to 7 joules for this skin type. This is my model's first treatment in a while. I'm going to start on the lower end of 6 joules. My pulse width will remain at 3 milliseconds. My rate is going to be dependent upon my level of comfort or your level of comfort when you're providing the treatment, as well as whether or not it's a flat surface area where I could use a faster rep rate, or there are more curves, as is the point with the face, where I might want to use a slower rep rate to make sure that I'm keeping that sapphire plate flush against the skin. For today's demonstration, I'm going to leave it at 2 hertz, which is approximately 2 pulses per second. The temperature of my sapphire chill plate is going to remain 25 degrees Celsius, and I'm going to select the larger adapter since that is what I'm going to use to apply my treatment to both cheek areas. My patient has on her Safe Start or protective eyewear, and I'm going to place on my BBL Safe goggles as well. I'm going to place my system into the ready mode, and I'm going to pulse a few times in the air away from me or away from anything that's colored, just to give my patient a chance to see the light before I start, which really makes it a little less of an intimidating experience for them. So I'm going to pulse a few times. 3, 2, 1. Okay. I'm going to go ahead and reset my pulse count, reset my total energy, and I'm going to turn her head away from me. And 95% of a successful treatment all has to do with your kinesthetic in a position that's comfortable for you in the handpiece. I like to stand when I do my BBLs. When I stand, I let gravity kind of take control of the cord. Therefore, I am still in control of that handpiece. I'm going to put my hand through the strap. That way I have a secure hold on the handpiece. And I'm going to make sure when I'm touching her skin that the handpiece is flush on all 4 sides, and I'm not pressing too hard. So I'm going to pulse over this way. I'm going to come above it and cover it in this direction. I'm then going to come back and crosshatch, ending up doing 2 passes. So this counts as 1 pass in one direction and a second pass in the other. So I'm going to go ahead and just raise this up a bit, and I'm going to count down 3, 2, 1. Is that comfortable enough for you?
Mm-hmm.
Perfect. Okay, I'm going to come right above the top. I'm going to come back the other way. Okay. Now I'm going to turn their cheek, and I'm going to do the same thing on the other side. Prior to treatment, we washed the face, we degreased the face to make sure that there was no makeup, there was no self-tanners, and we also made sure in our patient assessment that the patient has not had recent sun exposure or has any of the other considerations or contraindications which would keep her from having treatment. At this point, after I've done my 2 passes on the opposite cheek, I'm going to remove my smoothie. I'm going to select the 15 by 15 square icon, and then I'm going to place on the appropriate square adapter for the forehead, nose, lip, and chin. This is going to feel a little bit less intense or spicy for my patient because they're getting the energy in a smaller footprint. It's also going to reduce any chance of swelling that we might have around the eyes. I don't have to raise or modify my energy because we've already placed into our software the ability to modulate when you've pressed the appropriate adapter. So basically, the machine does the work for you. So I'm going to come underneath her eyes, and I'm going to do 2 passes. This is to allow me to get the tissue that possibly I didn't get earlier with a large sapphire plate. Again, we want to put as much light as we can into the skin because that's what's going to help us kind of prime and set the stage for correction of browns and reds. It's also getting us that great collagen growth. Now, if you get in and you feel that 2 hertz is too fast for you, that's the beauty of the Cyton system, is I can either slow it down or speed it up just by simply going back to my user interface. I'm then going to go to 2 passes of her forehead. And what I like to do is I'm very tactile. I like to cover their brows with my fingers, making sure that I'm avoiding not only her hair, but her eyebrow as well. Again, if you remember, I'm at 2 hertz now. I would rather take a little more time and do it slower and avoid those areas than go too quick. I'm going to pull back the goggle here, put my finger here to rest it upon, slide back, come down to the side of her nose, and I'm going to go. So I've kind of hit all 3 corners. So that way I've done my 2 passes at the center, my 2 passes on this side. So then I only have to move my handpiece once to get the other side. It just feels smoother for me as a provider. It feels a little smoother for them as well. Again, that's when kind of the artistry comes in. Now I'm going to have them pull their lips in together, and I'm going to slide it around the upper lip, kind of going to break it apart there. This is a spicy area. Now I like to have them put their tongue over their bottom teeth because this not only protects or blunts the heat from the enamel in their teeth, but it also kind of extends out that region, so it makes it a little bit easier for me. I'm going to coat that area, 2 to 3 pulses depending upon the size of their chin. And I'm going to go back again. If you're familiar with the traditional Forever Young BBL, the big difference is I'm able to do it much faster than before, but my passes remain almost the same pattern of cheeks, under eye, forehead, nose, lip, then chin. After we've completed our base pass or our primer pass, we're then going to go back into our software. You can see that I laid over 214 pulses. And I can go into actually correcting the chromophores that the patient is most concerned with. I've already completed the base in motion since that was an option on my system. I'll then go in and I will treat her diffuse redness or her rosacea if it's present, her facial vessels, her cherry angiomas, with each screen giving me questions giving me guide to the changing of the appropriate adapters for that area, and then if I've set everything up correctly, telling me what filter type, and then ultimately what settings to use. After I've completed correcting everything vascular that the patient might be concerned with, again, that's going to be diffuse redness all the way down to a more focused approach of your facial vessels and your cherry angiomas, my Forever Young BBL Plus or my Forever Young static photofacial with my pigmented lesion step. And again, it will give me a guide to what appropriate adapter to use based on the patient's skin type. Once you've completed that primer or that base pass, you've corrected any visible corrections that you might see. Your next option is to either add the skin type, if you have that on your system, or there is an optional third pass that you can do only on the cheeks called the photo finish, which is in your manual, which references using the 560 or the 590 filter for approximately 200 pulses per cheek. This does not take the place of the skin type. Again, it is a complementary step to your other passes and really kind of helps with your pores and your overall texture. Again, if you have the skin type, that's a great way to really correct color, tone, texture, and tightening in a single treatment. The optional third step, or the photo finish, can only be completed when using the Forever Young BBL Plus Soft Key, as it is an in-motion technique. Again, that really is used on the cheeks after you've finished your base pass and your corrections as a complementary third step.